Hi everyone, I'm Dr. Akhila, consultant, fertility specialist, Siddha Hospital, Banjara Hills, Hyderabad. Today we're going to talk about early pregnancy bleeding and its management. It affects about 25% of pregnant women who experience bleeding in their first trimester. And normally it stops in the first trimester itself, but sometimes it may continue till the second and the third trimester as well. So, what are the reasons as to why we can have bleeding in pregnancy? One, if we are suspecting a threatened miscarriage. Two, if we are suspecting probably a pregnancy loss. Three, if it's an ectopic pregnancy. These are some of the reasons why we can have bleeding in pregnancy. According to what the cause is, we give the treatment accordingly. But before that, it is very important that we do a few tests and figure out why is there a bleeding, what are the hormonal changes, and what best treatment can we give. So one of the most important tests is that of a beta HCG that we do when there is bleeding in pregnancy. So anything between 1,500 to 3,000 is called as a discriminatory value of beta HCG, wherein we can definitely see a pregnancy or a gestational sac once the levels of beta HCG are more than 1,500. Also, we look at the doubling of this beta HCG. If the beta HCG doubles, then we consider it as a ongoing normal pregnancy. If it falls or if it plateaus, then it may so be an ectopic as well. So that understanding we can get once we perform an ultrasound. In the ultrasound, we look at the gestational sac. Where is the gestational sac? The decidual reaction around the gestational sac. That is basically this how the support for the pregnancy is. Sometimes there could be a subchorionic hemorrhage just next to the gestational sac, which is why she's having this bleeding episode, which needs to be looked into. And apart from this, we look at the cervical length, and this is what we gather from the scan. Where this gestational sac is it inside the uterus or outside? All these can give us a good idea as to why there is bleeding in pregnancy, and accordingly, we can give the adequate treatment. Alongside, the moment the patient comes, it is of paramount importance that we check her vitals, that is the pulse and the BP, to make sure she's not in hypovolemia. So in the history, we need to find out how much amount of bleeding has happened. Accordingly, we can figure out what treatment to give immediately. So the moment there is a bleeding, it is natural that the patient is very worried and tense. So what you must do is call your hospital and talk to them. Some medicines can be given over the phone to just control that bleeding at that moment. And then subsequently, we can come to the hospital and get the vitals checked. And we also do a per speculum examination, which is very, very important. And in the per speculum examination, we can figure out if there is any vaginitis, cervicitis, infections because of which she may be having bleeding, whether it is a cervical polyp, which is why she's having this kind of bleeding. Also, a history of sexual intercourse can also be a cause for the bleeding. History of fall, has she fallen anywhere because of which she's having this kind of a bleeding episode, is something that we must find out. And what is what are the other tests apart from beta HCG is a progesterone test, which is very important. So where once there is this kind of a bleeding, we tend to increase the progesterone levels, as in we try to increase the progesterone tablets, so that this is the support to pregnancy. Once we know what the levels are, we increase the dosage or add on a progesterone in the form of an injection or a tablet or a vaginal tablet to continue to help us continue this pregnancy. The other important thing that we must remember is the blood group of the patient. If she's Rh negative, we may have to give her an anti-D accordingly. Apart from these investigations, also importantly, a hemoglobin needs to be done. If she has bled a lot, then we need to improve the hemoglobin, and what best needs to be done depends on what level of hemoglobin she is at. The other management protocol includes, importantly, there is no recommendation for any kind of a bed rest. At the same time, heavy activities, lifting weights, exercise, all this should be avoided. The patient needs to relax and stay calm, drink lots of water, avoid intercourse. All these are some of the basic things that needs to be done. Also, if the bleeding is extensive, then we advise the patient for a hospital admission based on how much amount of bleeding she's having. Now, how to understand what bleeding is heavy and what is normal. So, if she's soaking a pad which is completely soaked in probably 1 to 3 hours, this is considered as heavy bleeding. If there is passage of clots more than around an inch, that also is an indication that it is a heavy, it's an episode of heavy bleeding. All this needs to be figured out when we take the history, and treatment is given accordingly. So, of all the things, importantly, bed rest is not something that we recommend once there is this kind of bleeding episode. So, this is what I wanted to put across for the management of early pregnancy. Any questions, please? Like I said, it all depends on what your beta HCG is. Sometimes these urine pregnancy tests, the kits that we do, can be falsely positive. So we need a beta HCG to figure out whether this was even actual a pregnancy, or was it just a false test. Apart from bleeding, it is very important that we find out whether there is any pain or mild cramps. Very minimal pain and mild cramps is normal. But if the pain is severe and it is not tolerated by the patient, then that is something you need to go and talk to your doctor and find out why this is happening. Most often, this kind of a bleeding may lead to a miscarriage. If bleeding occurs, first and foremost, try to stay calm, don't panic. Second, try to call your hospital, try to talk to your doctor. Some medicines are given at that moment to control your bleeding. Depends on how heavy the bleeding is. If the bleeding is not too heavy, we can wait for these medicines to act and schedule a visit the subsequent day. But yes, once the bleeding has started, it is better to visit your doctor, if not at that moment, maybe the next day, to find out why it is happening. So, once you've had bleeding in your previous pregnancies, it's again a very important history. It can recur. Why it's recurring is something you need to find out. If none of the causes that I have mentioned are there, then there's nothing to worry. You can just continue your pregnancy as normally as what it has been in the previous 2 times. So why there is bleeding is we've already gone through all the causes. The first in the first 3 months, this bleeding can be because of implantation bleeding. It could be because of subchorionic hemorrhage. It could be because of an ectopic. It could be because of a miscarriage or a threatened miscarriage. So we need to, it could be cervicitis, vaginitis, detailed history and a physical examination with some blood tests and a scan will tell us what exactly is the problem and how to treat that. Does brownish spotting mean? Um, it means that there could be a slight implantation spotting or a bleeding, which is not something that you should worry at all. Um, some of the basic tests that I have mentioned is what we will do, and if everything is normal, nothing to worry. Signs of implantation per se, there are not really mild spotting or bleeding is not an essential sign of implantation. It does not mean that if you don't have this kind of a spotting or a bleeding, implantation has not occurred. So there are no particular signs of implantation, but you can have nausea, you can have bloating, you can have bleeding, and you can, these non-specific symptoms may be there once there is an implantation. But the definitive sign, the definitive test is that of beta test. So this kind of a bleeding can recur. So you need to talk to your doctor about it, if a scan was done or not, and how the scan is. Sometimes this kind of a bleeding can stop and recur, and like I already mentioned, most of the early trimester bleeding stops within the first 3 months, but sometimes it can continue into the second and the third trimester as well. So there's nothing to worry. It's just that you need to figure out if there is any abnormality in any of your tests and the scan, and take treatment accordingly.